My name is Alexa Wright, and I'm going to be performing the insertion of the nasogastric tube for my patient today. First, I'm going to state my 12 rights. I'm going to verify the care order for the patient, verify facility policy and procedure, and gather appropriate equipment and supplies, perform hand hygiene before and after patient care handling equipment, knock on my patient's door, identify the patient using 2 identifiers, note the overall condition of my patient, explain procedure and provide for privacy, don PPE if indicated, raise the bed for good body mechanics. Upon completion, I'm going to lower the patient's bed and raise the side rails according to the patient's care plan, and then I'm going to immediately report any abnormal findings to my charge nurse. So I have my patient today. For the NG tube insertion, some work I'm going to do prior to inserting the NG tube. I'm going to assess the patient's abdomen and do an assessment of that. I'm going to look at the patient's past medical history and note any facial fractures, nosebleeds, aspiration, or things like that. I'm going to assess my patient's height and weight according to like her body mass index, so the things that she needs for nutrition. I'm going to look at my physician's order and gather the appropriate nasogastric tube according to the size that the physician wants. I'll have like suctioning equipment if that's what the patient is getting the NG tube for, or feedings if that's what she's getting it for. So I'm going to first have the patient close each nair to assess the patency of the nairs. So she's going to do that on one side and then do that on the other. I have my supplies here. I'm going to perform my hand hygiene and get all this ready and set up. So I have my basin for if the patient needs that. I have my tissues for the patient. And then I'll have a towel to drape over the patient so that if anything comes out of the tube or anything like that, her clothing is protected and so is the bed. And then I have my syringe here. And then I've got my NG tube. I'm going to go ahead and get this open. Okay, and then I have my lubricant, and this is going to be water-soluble lubricant. And then I have a hypoallergenic tape to place on the nose to secure the NG tube. I have my water with a straw, and then I also have pH testing strips, and then whatever equipment is needed according to the physician's order. So I have my hands washed. I'm going to go ahead and put on a pair of gloves. I'm going to tell the patient of feelings that she may feel when I'm inserting this tube. I'm going to let her know that the sensation of choking or gagging will go away after we pass the oropharynx. I'll let her know that if she experiences any major discomfort, to tap her index finger to let me know that something's wrong and to stop. So I'm going to do some measurements first of my tube. So after assessment, I have figured out that her left nair is patent and good for use after looking in it and not seeing any loss of tissue integrity or anything like that. So we're going to use the left nair. So I'm going to measure from the tip of the nose to her ear, and I'm going to mark that. And then from the ear down to the xiphoid process, so this would not be here. And I'll measure that right there, so I have my marking. So I'm going to come over here. That's ready. I'm going to put the emesis basin in front of my patient. She needs it. And then I'm going to put my water-soluble lubricant 3 to 4 inches down the NG tube. Get that ready. Then, just for safety, I would perform hand hygiene again and put on clean gloves. So once my patient is ready and understands the procedure, I can put a pillow behind her head to have her up. I would have the patient in a semi-Fowler's position and ready for that. All right, so I've got my NG tube. Now, during this procedure, I would have a second set of hands for the water so that whenever I tell the patient to drink the water, my helper can stick that cup in front of her and make sure that she's swallowing as I ask. So for the first part of inserting to my first line, I'm going to have the patient tilt her head a little bit backwards. And I'm going to insert, so here we go. All right. So she should be coughing, and then once I make it past the oral pharynx, I'm going to have her tilt her head forward, and that's where my help is going to come in handy. All right. So I'm going to also emphasize the need to mouth breathe during this. All right, so you'll take a drink, and as she swallows, I will further insert the tube. Swallowing, okay. So we have made it to our line. Then I'm going to take my tape, which I should have already had this ready. And when I prepared this, I'll have 3 to 4 inches, and I will just secure the tube in place on my patient's nose. Okay, so next I'm going to verify placement by the pH of the gastric aspirate, and it should be below 5.5, so I would take some of that and then put it on my pH test strip. I would note the color and consistency and amount of my gastric aspirate, and I'd have that on my pH test strip. I would also follow the physician's order with the x-ray to verify the placement of the tube. So we would do that, and then once I had the verification that it is in the correct spot, I will secure the NG tube better to my patient so that it doesn't come out of place. So I can secure this on the cheek so it's out of her eyesight. That promotes better comfort. And then also I will tape it to her gown. And I could use Tegaderm as well for the securing of the tube. And then I would do whatever I needed to do with this NG tube according to the physician's order, whether it be feeding or suctioning. And I would follow the rate that the physician ordered. I would place the patient in a position where he or she is comfortable. And then I will document which nair I put it in, how I secured it. I'll put the distal end of where the location of the NG tube is, and then I'll also document the pH of the gastric aspirate and the feeding rate or suctioning or whatever the physician ordered. I'll document that. And that is it.